Hello friends, welcome again to my channel. Dr. Kazmi here, and this is going to be a very brief, very short video. And today I'm going to tell you uh, if in your clinical practice you come across a child who has got a solitary or a spreading rash which is blistered, has blistered, or was blistered, or it's just like sort of a peeling rash, as some parents they prefer to call it, then what are your differential diagnosis? Now, please keep it in mind. Then, when you are, confronted with such a situation, you have to see whether the blistering rash is just a solitary lesion or is it a widespread lesion. If it is just a solitary lesion on any part of the body without any encrustation or something, it might be what we call as a solitary lesion of bullous impetigo. Now, bullous impetigo is usually a streptococcal infection of the skin, and some kids can have a solitary lesion, especially if there was a minor graze and then it was infected by streptococci. They can get a sort of a localized infection, which can blister, and usually this blister pops within a couple of hours, and you might see a raw surface beneath. Might be more common in the younger infants, especially even in the neonate period. So if you are concerned with such a situation, most of the time it's a bullous impetigo. And the next question is to see if the child is systemically well or unwell. So if the child is systemically well, he's not have any fever or any constitutional upset or symptoms, then you can treat it with topical antibacterial creams. Normally, we use fusidic acid or topical mupirocin. So you have to prescribe either topical fusidic acid, fusidine, or topical mupirocin, and that has to be used thrice a day. So once application in the morning, once application in the afternoon, one at night time, usually for 5 days. If the blistering rash is widespread, then again you have to see, because there are a few other differentials. Widespread blistering rash, if the child is very unwell with it, he's got fever or he's just simply not doing well, then you have to see if he has got a primary infection somewhere. And most of the time, this primary infection would be either somewhere around the mouth, or it might be in the throat in the form of streptococcal sore throat. So usually some of the streptococci, what they do is that apart from the local infection, they excrete what we call as exfoliative toxin, which can go in different parts of the body. So it goes away from where the primary infection is, and it can cause widespread desquamation. So you'll be having peeling of the skin at the peripheries, around the digits, around the hands, and usually that's quite a painful condition. So you have to see if the primary infection is in the throat. This might be what we call as the widespread form of impetigo, and we call it a streptococcal toxic shock syndrome as well. Remember, the toxic shock syndrome can be caused by staphylococci as well. It can be caused by streptococci as well. So staphylococcal is a more serious condition, but even streptococci can cause that. So if you've got infections somewhere around the mouth or in the tonsils, this widespread phenomena of blistering might be because of the toxins excreted by the streptococci bacteria. One thing more is, like, if this is just accompanied by swelling, a little bit of peeling, one important differential diagnosis is Kawasaki disease. So Kawasaki disease also presents more or less similarly like to streptococcal infection. The only thing is that it has got a criteria. So there won't be fever for more than 5 days. There won't be cervical retinopathy. There won't be some cracking of the lips, and some ulcerations on the tongue as well. The child might be having a polymorphous rash, and there would be some swelling of the digits or peeling of the peripheries. So remember, in such a case, the important differential diagnosis is between Kawasaki disease and between streptococcal toxic shock syndrome. So remember, if streptococcal toxic shock syndrome, you have to be very aggressive in your management, and you have to treat the child as an emergency, and definitely that would require a systemic IV treatment. If it is Kawasaki disease, again, the child needs to be admitted, because You have to see if there are any coronary aneurysms, and the child has to be treated properly. The other thing which can give you a blistering widespread rash, especially in the neonatal period, is epidermolysis bullosa. So epidermolysis bullosa comes in different varieties. It can have autosomal dominant type. It can have the autosomal recessive type. And usually what happens is that the junction between the keratinocytes, they are broken down. So the skin gets very easily blistered. And these blisters can be popped very easily, and usually it has to be treated. Usually in this condition there will be widespread blistering all over the body, and it has to be treated like burns. So obviously that requires very specialized treatment. So please keep it in mind, widespread blistering, if it is a neonatal period and you can't find an infection, a focus of infection, most of the time it might be epidermolysis bullosa or any of its type. In older kids, you have to differentiate between streptococcal infection like scarlet fever or streptococcal sore throat, and its widespread manifestation in the form of streptococcal toxic shock syndrome. And the other differential diagnosis would be Kawasaki disease. So this was just a short video to tell you what are the some of the common differentials regarding a solitary blister or a blistering rash in a child. Thank you very much. If there are any questions further about this particular topic, you can put down your question in the comment section below, and I will get back to you and answer it. Thank you very much and have a good day. Bye.